So hi everyone and welcome again to this video series. We are into the second video and here also we will be discussing the MCQs from the upper limb topic. Welcome all, I am Doctor Ankit and this is our channel Human Anatomy by Doctor Ankit. So without wasting any further time, let's start the video over here and I hope you are enjoying the previous video. Any comments or anything or that is most welcome. Kuch bhi laga ho to do try to share. A 43-year-old woman comes to the physician because of tingling and weakness in her left arm for the past 2 days. So what are the findings over here? Tingling and weakness, left arm, 2 days. Okay. Image of the brachial plexus is shown in the question. Nerve conduction study shows a decreased transmission of electrical impulses in the labeled structure. Where is the labeled structure? Labeled is over here. Let me put a red arrow over here. This circle over here is the labeled structure. Physical examination is most likely to show impairment of which of the following movements? Okay, very good question. So nothing specific over here, just a labeled structure. In the diagram of the brachial plexus we can see. Now let's decode the diagram, right? So this is the brachial plexus, we can very easily see. C5 and C6 they form the upper trunk, C7 forms the middle trunk, C8 T1 they forms the lower trunk, right? Now the ventral rami of the upper and middle trunk, they form this lateral cord. The ventral rami of the lower trunk will form the medial cord. And now this blue color, this from the dorsal rami, from all the three trunks, they form the posterior cord. You can see over here that this posterior cord is giving off two branches and one of them is labeled. So what are the two terminal branches of the which cord? The posterior cord. So if we recall the basic anatomy, posterior cord, what were the branches from the posterior cord? The mnemonic for the posterior cord branches was, for medial cord it was M4U, for lateral cord it was LML, and for the posterior cord it was ultra or ulnar, ultra latus, right? Ultra, in ultra U refers to what? U refers to the upper and the lower subscapular nerve. So this is the subscapular nerve, upper and lower. T refers to the thoracodorsal nerve, that is our nerve 2, latissimus dorsi. R and A, these are the two terminal branches of the posterior cord, and R and A over here are the radial and A is for the axillary nerve. So this labeled structure is either radial or the axillary nerve. This much we have reached down. Now we have to look at the options, because in this image both of them are shown to be of equal caliber, though we know that the radial nerve is bigger than axillary. So radial nerve should be thicker, moti honi chahiye than the axillary nerve. But now we know that if the radial nerve is damaged, what features can be there? If the axillary nerve is damaged, what features can be there? Just to recap, radial nerve supplies all the posterior compartments, ठीक है ना? Posterior compartment of arm and forearm. Axillary nerve mainly supplies two important muscles, the deltoid and the teres minor. ये basic knowledge है which we should have. Now come to the options. Option 1, extension of the wrist and fingers. Now this will be lost in which nerve palsy? Radial nerve palsy can be the answer. Second option is opposition of thumb. Opponent's pollicis is supplied by which nerve? Median nerve. So ये तो हो नहीं सकता answer. This cannot be the answer. Flexion of the metacarpophalangeal joint, again by the FDS, again median nerve, again C नहीं हो सकता. Flexion of the forearm, mainly by the biceps brachialis. For this we have the musculocutaneous, ये भी नहीं हो सकता. I hope we got the answer. Option A, extension of wrist and fingers will be lost. So this labeled structure कुछ और नहीं था. This was actually been shown as a radial nerve. बात खत्म. So we should be clear about the images as well. Here is the image of the entire brachial plexus. यहाँ पे image देखो आप आराम से. Look at this purple color. This is your posterior cord, posterior cord, and its two terminal branches over here are axillary and the radial nerve. Right? Go through this diagram. Take a screenshot, or if you have, fine. Here everything is given. Roots, you have ventral rami ki branches, trunk, division, cords and their terminal nerves. They are all given over here, right? Let's move to the second one. Second one, दूसरा question देखते हैं. 23-year-old man was injured in a motor vehicle accident and X-ray confirmed a displaced distal radius fracture in his left forearm. Right? So there is a displaced distal radius fracture. Upon examination, the patient exhibits, अब देखो findings क्या क्या है. Weakened pronation weak है. Weakened flexion of the index and middle finger at the DIP. ये हमने we have done this question yesterday. DIP में there is weakened flexion at the index or middle finger, and weakened flexion of the IP joint of the thumb. बिकॉज थंब ओनली हैज 2 phalanx, तो यहाँ पे IP जॉइंट होगा. When asked to make a OK sign, the patient is unable to make a rounded circle producing collapse circle. तो OK ऐसे राउंड की जगह collapse circle बन रहा है. No areas of sensory loss, so there is no sensory loss, it is only motor loss. Which nerve is most likely damaged? Now इसको आराम से एक एक पॉइंट लेकर चलो. Weakened pronation. Now pronation over here, पहला पॉइंट लेते हैं. Weakened pronation. Pronation is done by 2 muscles, pronator quadratus या pronator teres. Weakened है, so सपोज कोई एक मसल इसमें पैरालाइज हो गई होगी. प्रोनेटर क्वाड्रेटस सप्लाइड बाय व्हिच नर्व? एंटीरियर इंट्रोशियस. प्रोनेटर टीरियस बाय मीडियन नर्व. एंटीरियर इंट्रोशियस भी मीडियन नर्व की ब्रांच है. एंटीरियर इंट्रोशियस इज अ ब्रांच ऑफ मीडियन नर्व. सेकंड फाइंडिंग, वीकेंड फ्लेक्शन एट द डीआईपी ऑफ इंडेक्स मिडल. तो ये क्या गया? हियर वी हैव दी एफडीपी मसल का पैरालिसिस ऑन द लेटरल एस्पेक्ट. तो व्हिच नर्व? एंटीरियर इंट्रोशियस नर्व. देन वीकेंड फ्लेक्शन ऑफ आईपी ऑफ थंब. व्हिच मसल? फ्लेक्सर पॉलिसिस लॉन्गस. थंब में आ जाओ तो फ्लेक्सर पॉलिसिस लॉन्गस. सप्लाइड बाय व्हिच नर्व? अगेन आंसर इज एंटीरियर इंट्रोशियस नर्व. तो ना तो ये फ्लेक्स हो रहा है, नाइदर द थंब इज फ्लेक्स, नाइदर द डीआईपी ऑफ दीज 2 फिंगर्स आर फ्लेक्स. एआईएन की इंजरी है इसमें. ऑप्शन एआईएन आपका सी है. तो सी तो आंसर हो गया फॉर श्योर. एक फाइंडिंग और बच गई. देयर इज वन मोर फाइंडिंग लेफ्ट. देन व्हेन आस्क्ड टू मेक अ सर्कल, ओके साइन, मेकिंग कोलैप्स्ड सर्कल. एबनॉर्मल पिंच साइन बोलते हैं. दिस इज नोन एज व्हाट? इट इज नोन एज एबनॉर्मल पिंच साइन. एबनॉर्मल पिंच साइन, राइट. सो प्रॉब्लम कौन से हाथ में थी? प्रॉब्लम वाज इन द लेफ्ट वन. याद रखो, लेफ्ट में. ओके, सो इफ यू लुक एट दीज 2 हैंड्स, दिस इज द लेफ्ट हैंड एंड दैट इज द राइट हैंड. दिस इज डूइंग एन ओके साइन. यहाँ पर व्हाट इज हैपनिंग इन दिस इमेज, some red arrows, look at the flexion of DIP of the index finger and look at the flexion of the IP joint of thumb. यहाँ पर ये दोनों पॉसिबल नहीं हो पा रहे हैं, therefore collapse circle है. Right, got the point? Answer is anterior introitious nerve. In this image, the image we have seen earlier also, but here let's decode. Start with this. This is the flexor pollicis longus. That is flexor digitorum profundus. ठीक है? And if you remove these tendons over here, कहाँ से tendons सर? यहाँ के tendon का हटा देते हो. And what you see is a deeper lying muscle that is pronator quadratus. तीनों यहाँ पे क्यों दिखाई हैं? Because all of them are supplied by anterior interosseous nerve, which is itself a branch of किसकी branch है? It is a branch of median nerve. Okay, so remember this point and about the anterior interosseous nerve, and remember it is a pure motor nerve. चलिए अगला क्वेश्चन देखते हैं. Let's see the next one. I hope image देख के ही आधे लोगों को तो क्लियर हो गया होगा क्या है क्वेश्चन. 45-year-old lady presents to the clinic with discomfort in her left shoulder. She recently underwent a left mastectomy, okay, and axillary dissection for the breast cancer. History be important. History is very important. The history of surgery around the left pectoral region and left axillary region. Breast के साथ lymph node हटाई. Physical examination shows a notable protrusion of the posterior left shoulder blade. When she is asked to push up against the wall, we know we are dealing with what? We are dealing with the winging of scapula. We are dealing with winging of scapula. In which winging? It is a medial winging of scapula. Which winging? Medial side. Which of the following spinal nerve roots gives rise to the most likely affected nerve branch? So पता होना चाहिए that which muscle are we dealing with over here, है ना, and which nerve are we dealing over here. अभी मसल का पता है तो नर्व पता होना चाहिए. The muscle over here is which muscle? It is serratus anterior, है ना, and the nerve supplying serratus anterior is nerve to serratus anterior, also known as nerve of Bell बोल दो, या फिर you can also call it as long thoracic nerve. What is the relevance of history of the patient with this nerve? But dissection was done on the axillary side, axillary dissection, and this nerve lies on the medial wall of axilla. Because the whole muscle is lying in the medial wall of the axilla, तो उसी के ऊपर superficial to the muscle runs this long thoracic nerve. तो इसका relation बन गया, it lies on the medial wall of axilla, and it might have been damaged while doing the axillary dissection. कट गई होगी, damage हो गई होगी, leading to. Now they are not asking the nerve. अभी एक थोड़ा सा भी कहानी बाकी है, थोड़ा सा और रह गया. वो asking the root value C3, 4, 5, 5, 6, 5, 6, 7, C81. Images ध्यान से देखनी चाहिए. Its root value is C5 to C7 long thoracic nerve. अभी we have done a previous question. यहाँ अभी previous question किया था, ये देख लो, brachial plexus diagram था. Okay, very good. Have a look over here, the long thoracic nerve coming from the root of the brachial plexus. Now trace it. इसकी trace करो, roots कहाँ से आ रही हैं? This nerve is coming from where? Come here, here and here. क्या है? C5, C6, C7. काम आता है कभी कभी. So here therefore the answer over here would be our C5 to C7. Muscles देख लो बेटा यहाँ पे, look over here. This is the lateral view with the anterior side over here or posterior over here, and this muscle over here is your पूरी muscle क्या है? It is a huge muscle. बहुत बड़ी muscle होती है. It helps in pushing punching movement. पूरी आप upper limb को आगे push करने के लिए it is helpful. This serratus anterior muscle, ठीक है? It has 8 digitations. 8 digitations होते हैं, right? Okay. So this is the serratus anterior forming which wall of the axilla? Medial wall of the axilla. And do also remember कि यार यहीं पर over here only you will find the nerve coming down. That is the long thoracic nerve. तभी if the dissection was done over this area, a nerve could have been damaged. That was the case. Look over here also in a dissected image over here. यहाँ पर questions can come directly. ऐसे structures, कुछ structure यहाँ देख लेते हैं. चलो, identify this muscle. Which muscle is this? Rounded contour of shoulder, deltoid हो गई, बात खत्म. Identify this muscle, key muscle in the pectoral region. सर ये तो pectoralis major है या minor है? Major तो नहीं है, क्या है? What is this? Major has been cut. This is the cut end of P major. And this over here is pectoralis minor, the key muscle in the axilla. And this over here, ये जितने भी digitations दिख रहे हैं आपको, these all digitations over here. This over here, this is the serratus anterior. ये है हमारी serratus anterior muscle. Okay. So let's see the next one. A 21-year-old comes to the emergency department because of severe pain in his left shoulder. 21 साल के आदमी को लेफ्ट शोल्डर में पेन हुआ, ठीक है, and numbness in the lateral aspect of the arm. दर्द हो रहा है और numbness हो रही है in the lateral aspect of arm in a young man. This occurred after being tackled from behind as he was throwing a football. फुटबॉल मैच चल रहा है. There is a football match going on and he is throwing में football normally we use low limb, but you know जब outside होती है, out होती है, then the players they throw from the boundaries of the ground, throw in करते हैं ना. So in this position he was attacked from behind. होगा कुछ. An X-ray of the shoulder is shown. He is found to have a nerve injury. X-ray लिया गया and they found a nerve injury. Weakness in which of the following motions would be most likely in this patient? ठीक है. So there is a mechanism of mode of injury कि upper limb is abducted और पीछे से there has been a force. एक्सरे भी दिया हुआ है आपको. एक्सरे में ट्राई टू आइडेंटिफाई क्या गड़बड़ लग रही है इसमें. एंड देन दे आर सेइंग कि यार दे हैव फाउंड अ नर्व इंजरी, बट नर्व इंजरी सेकेंडरी, फर्स्ट देयर इज अ सम एक्सरे प्रॉब्लम कुछ है कि नहीं वो देखते हैं. लुक ओवर हियर, टू थिंग्स आई एम पुटिंग रेड एरो ओवर हियर. ये क्या है? दिस इज द ग्लिनॉइड फोसा. एंड लुक एट द हेड ऑफ द ह्यूमरस. दिस इज द हेड ऑफ द ह्यूमरस. देयर इज अ डिसलोकेशन हो गया. देयर इज अ डिसलोकेशन एट द शोल्डर जॉइंट. पीछे से फोर्स लगी है, प्रॉब्ली इट इज एंटीरियर डिसलोकेशन ऑफ द शोल्डर जॉइंट. अब अगला क्वेश्चन आता है, देन देयर इज अ नर्व इंजर्ड. कौन सी नर्व इज रिलेटेड टू द एरिया ऑफ द शोल्डर जॉइंट? कौन सी नर्व है वहां पर? द नर्व दैट वाइंड्स अराउंड द सर्जिकल नेक ऑफ ह्यूमरस. सर्कमफ्लेक्स नर्व. सर ये कौन सी नर्व है? सेम एज एक्सिलरी नर्व. फ्यू इयर्स बैक a question came, few years around a couple of years back, a question came in INICET, I recall. In that the answer was axillary nerve, but axillary nerve was not in the option में नहीं था. Instead of axillary nerve, the examiners gave the option as the circumflex nerve. तो याद रखो इसका एक और नाम है circumflex nerve, which is not wrong. क्यों? क्योंकि it is circumflexing around the surgical neck. So if the axillary nerve is damaged, है ना, then weakness in which of the following motion. So axillary nerve mainly supplies which muscles? Only two muscles. कौन सी हैं वो दो muscles? One is deltoid, one is teres minor. ठीक है, deltoid and teres minor. So what is the main action of deltoid muscle? तो deltoid muscle का main action क्या है? The middle fibers of the deltoid, they are the chief abductors of the shoulder. Abductors हैं shoulder के. जब भी आप हाथ ऐसे करोगे, whenever you will abduct, you always will feel tightness at the top of your shoulder. हमेशा, no matter how much bulky muscles you have or not. आपने जहाँ है, the moment you slightly abduct, there will be tightness. That is deltoid muscle. And what is the main action of teres minor? Teres minor का main action क्या है? Anyone? हाँ जी, comment box में लिखते रहो if you want to. Teres minor, it helps in lateral rotation. It helps in lateral rotation. है ना, teres minor is attached on the posterior aspect of the greater tubercle. वो कराता है upper limb का lateral rotation. So these two actions, ये दो actions involve होंगे because we identified कि nerve injured कौन सी है, what are the muscles. अब देख लो options. First option is forearm pronation. Now forearm pronation relevance यहाँ नहीं बनेगा because it is supplied by these two muscles. It is done by these two muscles. The axillary nerve does not supply. Shoulder abduction, perfect answer बना. Shoulder abduction, deltoid गया because axillary nerve is damaged. और options भी देख लो. Shoulder internal rotation, that is medial rotation, not the lateral one. Which muscle causes the internal rotation of the shoulder? बताओ भाई. The muscles which are attached on the front of the humerus. We are the lady between two major, बस वही सारी. P major, lady में latissimus dorsi and other major is T major. Then there is another muscle subscapularis, ये भी कराएगी because it is attached anteriorly in the lesser tubercle. Last option, wrist का dorsal flexion. Dorsal is this, or you can say extension, that is done by the extension of forearm. तो यहाँ पे जो nerve आएगी और posterior interosseous nerve. Answer over here is obviously our option number B. ठीक है. Here look at the similar image. देख लो यहाँ पर, they have shown the same thing, the glenoid and the head of humerus. It's a dislocation case, and here you can see the various muscles, mainly the deltoid over here, which was the one that was injured. So इसका paralysis हो गया, then there will be loss of abduction. Also look in this image, यहाँ पे this muscle is obviously the pectoralis major. देखते जाओ ध्यान से, pectoralis major, deltoid. A good student is that जो खाली question पे focus, who is not only focusing on the question, but on all the relevant information जो मिल रही है, जो नहीं बोल रहा हूँ उसको भी समझो, क्या पता कोई चीज़ कैच कर लो. Look at the images, जो labeled है, सब कुछ देखो. What is the cephalic vein doing over here? This is which area? This is known as a clavipectoral triangle. This is known as clavipectoral triangle. और you can also call it as a deltopectoral groove भी बोल सकते हैं इसको. Clavipectoral थोड़ा ऊपर होगा. This is the deltoid muscle, ये pectoral. This area is known as deltopectoral groove. Content is cephalic vein. It's a superficial vein. ठीक है, ये क्वेश्चन आ सकता है ना cadaveric image. अगला क्वेश्चन देखते हैं. लेट्स सी द नेक्स्ट वन. 12-year-old boy, teenage है, is brought to the emergency because of pain and weakness along the left forearm and wrist after falling 2 days ago. तो लेफ्ट फोरआर्म और रिस्ट में दर्द हो रहा है 12 साल के बच्चे में. 2 दिन पहले गिर गया था. He fell 2 days back. Physical examination shows a decreased grip strength and ability to make a fist. ना फिस्ट बन रही, ना ग्रिप में भी कमजोरी हो रही है उसके. एंड डिफिकल्टी द प्रोनेशन ऑफ द फोरआर्म ऑल ऑन द लेफ्ट. ना तो प्रोनेशन हो पा, देयर इज वीकनेस इन प्रोनेशन, ना ग्रिप बन रही है, एंड देयर इज आल्सो डिक्रीज ग्रिप एंड इनएबिलिटी टू मेक अ फिस्ट. सेंसेशन इज डिमिनिश्ड. कहाँ पर? सेंसेशन वाले पॉइंट्स दे गिव अ गुड हिंट. बिकॉज इन अपर लिम्ब नॉर्मली द क्वेश्चंस कम ऑफ इंजरीज. वन थिंग इन बिटवीन आई वांट टू टेल यू, अपर लिम्ब एंड लोअर लिम्ब में द क्वेश्चंस नॉर्मली कम ऑफ इंजरीज, फ्रैक्चर्स, nerve injuries, vascular injuries, vascular problems in lower limb, varicose veins, upper limb brachial plexus. Why? Because these are appendages. They are very much mobile compared to other part of the body. Up head neck, you look at head neck and the trunk, and look at the upper and lower limb. They are very much mobile, so they are frequently damaged. Therefore, questions come from there. Sensation is diminished in the left thumb and the lateral 3 fingers of the left hand. Lateral 3 fingers में sensation यहाँ loss हो रहा है. Okay. X-ray is also given of the left arm. Which of the following nerves is most likely injured? Also, please do focus at the age of this child. 12 year, 12 साल का बच्चा है. लेफ्ट में सेंसेशन इज लॉस्ट, ना ग्रिप बन पा रही है, ओके, ना फिस्ट बन पा रही है, डिक्रीज इन प्रोनेशन ऑल्सो. ना एक एक करके चलें. देन सेंसेशन, इफ यू टॉक ऑफ सेंसेशन, देन दिस एरिया इज बेसिकली मीडियन नर्व. ठीक है, वन थिंग. Grip, that is the grip is what? This is making a fist is what? Flexion of the fingers, mainly by the front of forearm muscles. This front of forearm is supplied by which nerve? Again, median nerve. Sensation may be median nerve. Weakness of pronation, pronator quadratus, pronator T is supplied by, तीसरा point, भी median nerve. Now look at the fracture over here. Fracture ध्यान से देखो. What has happened over here is trying to show us, if you look carefully over here, this is the supracondylar fracture. Look at the age of the patient also. बच्चा है 12 साल का. Supracondylar fracture. The most common nerve injured in supracondylar fracture कौन सी होती है? There is anterior interosseous nerve. But sir, anterior interosseous तो motor nerve थी. हाँ, but ऐसा नहीं कि it is the only nerve that can be injured. After that, median nerve can also be injured. After that, radial nerve can also be injured. After that, ulnar nerve can also be injured. So AIN is obviously a part or a branch of the median nerve, but median nerve can also be injured. इसमें simply the median nerve is the culprit or the answer over here. Combining sensory and motor and the supracondylar fracture, median nerve is the answer over here. ठीक है, not the axillary, not musculocutaneous, not the radial. Got the point? Okay, have a look at this image. Another image of the similar, ये image भी आ सकती है, वो तो supracondylar fracture. Supracondylar fracture, and you know the age wise also, if orthopedics में पढ़ोगे, it's quite common in this age. Okay, so moving on to the next one. A 12-year-old boy is brought to the clinic for right hand pain. Again, the age is similar, but pain is in the right hand. He was evaluated in the emergency 2 weeks ago after falling on his outstretched right hand. X-ray of the hand at the time showed no obvious fracture. 2 दिन पहले X-ray showed no fracture, and the patient was discharged home with a splint. On today's examination, there is tenderness to palpation of the anatomical snuff box. याद रखिए, this is anatomical snuff box, is a very very important topic. Repeat X-ray of his right hand is shown. Which of the following is the most likely diagnosis? So we can understand कि यहाँ looking at the history of the patient and the location of the tenderness and the X-ray over here looks like कुछ ना कुछ there is some bony abnormality around the anatomical snuff box. The bones which form the base of the anatomical snuff box are our scaphoid, right? Then you can also have lunate, a part of lunate, but trapezium होता है. There is a trapezium, and there is base of first metacarpal. All this can be involved because they are at the base of the anatomical snuff box. The most common fractured carpal is the scaphoid, and though the bone is very small and fracture can be there, and it might be missed initially, but later on all the symptoms and signs are showing us. Therefore, it is the osteonecrosis. कैसे? Now look over osteonecrosis. What is? You will see the increased opacity because callus formation होगा. And now look over here. यहाँ पे देखो ध्यान से. This is the radius bone. That is the ulna. That is the thumb. Obviously, look at the increased opacity over here. This is pointing out towards the osteonecrosis because fracture scaphoid हुआ था and that was missed 2 days back. Normal splint लगा है, ठीक है. But then obviously उसको pain बढ़ता रहा and tenderness हो रही है अब. And now you are seeing increased opacity around the scaphoid bone. It's case of osteonecrosis. और options भी देख लो. Arthritis का मतलब नहीं बनता. Myelitis, there is no fever and no history like that. Osteoporosis, age, and you can easily rule out the other options. Age देखो उसकी, infection, fever कोई history नहीं है. Osteonecrosis is the answer. Scaphoid तो all इस image को भी ध्यान से देखो. Identify all the carpals. सारी carpals identify होनी चाहिए. 8 carpals are there. Remember over here the pisiform is sitting over triquetrum. Pisiform जो है that is sitting over triquetrum. Look for the radius and ulna. कौन सा lateral है, कौन सा medial है. And then remember the mnemonic. We all should be knowing it. From lateral to medial, if you go, the mnemonic is proximal row में she looks too pretty. She looks too pretty. Try to catch her. है ना? This is the mnemonic from lateral to medial for the proximal row as well as the distal row. Proximal row, this is the distal row. Okay, fair enough. Let's see the next one. 58-year-old lady comes to the emergency because of severe left arm pain. Age difference हो गया ना. 58-year-old lady, left arm pain after slipping and falling. So pain हो रहा है after slipping and falling on ice on her driveway. On examination, she has tenderness and deformity over the lateral side of the middle of her left arm. मतलब लेफ्ट आर्म के मिडल में, लेटरल साइड में यहाँ पर शी इज हैविंग व्हाट, टेंडरनेस एंड डिफॉर्मिटी भी हो रही है. Which bone is there? Humerus is there. ठीक. She is unable to move her left shoulder due to pain. Obviously, when there is a pain over here, there is a deformity. Movement में pain होगा. Examination of a wrist and hand reveals weakness. अब देखो, wrist and hand. Examination reveals weakness where in the wrist and finger extension. ऐसे तो हो रहा है, but ऐसे करने में to extend the wrist and extend the finger, there is weakness. On the other hand, she can easily do, but on this hand, there is some weakness. Power loss हो रही है. Right? An X-ray of her left humerus is shown. Which of the following nerves is most likely injured? Remember, where was the injury? Where was the tenderness? Where was the deformity? They all were present at the left arm, middle में. And what is the finding? Clinical finding with examination. What are the findings given? That extension. There is a loss in extension. Not loss, but extension is weakened. Now, extension of the wrist, extension of the fingers are done by which group of muscles? They are done by muscles in the posterior compartment of forearm, which are basically supplied by the posterior interosseous nerve, that is a branch of radial nerve. Is radial nerve anyway related to the arm? Yes, very much related. It runs in the radial groove. Radial nerve यहाँ पर humerus से, it is very very close to the periosteum of the bone. इट रन्स फ्रॉम मीडियल टू लेटरल पीछे ऑन द रेडियल ग्रूव और द स्पाइरल ग्रूव. अगर यहीं पर फ्रैक्चर हो गया, एंड यू कैन सी द इमेज एज वेल ओवर हियर. क्या बोला? इट इज ऑल सेल्फ एक्सप्लेनेटरी. द प्रॉब्लम लाइज इन द रेडियल नर्व. ओके, आंसर इज रेडियल नर्व passes through the radial groove, and here you can see ये 3 नर्व याद रखो. They can ask on any day. Axillary nerve क्वेश्चन अभी आया, we have discussed. Radial nerve and ulnar nerve behind the medial epicondyle, ये 3 nerves. Why these 3 only are given? यहाँ तो और भी nerves होती हैं. There's median, musculocutaneous, बहुत सारी nerves हैं. Because the 3 nerves are directly related to what? They are directly related to the bone. कौन सी bone? Humerus. ठीक है. So this was the answer. So that's all for the day's session. If you guys are enjoying, don't forget to press the like button, share karo, subscribe if you have not yet subscribed, then subscribe. Again, I repeat the schedule. You might have seen the beginning of the video as well. It's going to be weekly at 8 p.m. Initially we planned at 5, but I guess 8 p.m. is the correct time. And week wise we have divided. This is the first week, second video upper limb, and tomorrow we'll come with more questions of upper limb and probably a couple of questions from the lower limb as well. Right? So that's all. I hope you are enjoying, and bye bye. Take care. See you soon.